Most of us will feel disgusted to see rodents walking around us, right? Maybe that's our defense system that has already been built into our subconsciousness because there are many diseases related to rodents in human history. While the rodents walk completely unscathed, the story changes drastically if the virus jumps to humans, as it will cause sudden, severe, and sometimes fatal illnesses. But how do we contract the virus in the first place? And what makes it so dangerous? Hantaviruses are a deadly family of viruses lurking inside everyday rodents like mice and rats. Humans generally contract the virus to contact with animals, usually from rodent urine, droppings, or nesting materials that are disturbed. However, in rare cases, it spreads from person to person. When it enters the body, it starts to infect the cells to replicate itself, specifically the cells in the lung alveoli, called endothelial cells. The alveoli is the part of the lungs that is responsible for the exchange of gases into the bloodstream. It is lined with endothelial cells, the primary target for the hantavirus. The plan is for the virus to enter the cells and take over it. It uses its surface glycoproteins, which are called integrins, to bind to receptors on the surface of human cells. Once the virus binds to the integrin receptor, the cell membrane folds inwards, holding the virus in a bubble called an endosome. The virus then releases its genetic material in the form of single-stranded RNA into the cell cytoplasm to begin replicating. Generally, viruses infect a cell and then burst the cell membrane, spreading the virus everywhere. Hantavirus, though, doesn't do that. It simply keeps on replicating inside the cell indefinitely without bursting or killing the cell. By this point, there appears to be nothing particularly suspicious going on. The patient will feel symptoms similar to a stomach flu. At day 5, however, things begin to take a dark turn. And now, the symptoms are undeniably and terrifyingly obvious. Through the bloodstream, the virus spreads into the lungs. The virus replicates inside the endothelial cells of the lung capillaries. It sheds new viral particles directly into the bloodstream without bursting or destroying the whole cell. Finally, the body realizes that its blood vessels are infected. It dispatches T cells and natural killer cells to fight the infection. It triggers inflammation, which causes the blood vessels in the lungs to release fluid. What's the fluid, you may ask? It's blood plasma. The fluid will flood the air sacs in your lungs, called alveoli, which will cause them to be unable to move oxygen and carbon dioxide in and out of the blood. This will cause a lack of oxygen in the blood, the fancy medical term being hypoxia. It is by this point that patients usually rely on ventilators to survive. If left untreated, however, this will rapidly deplete the brain supply of oxygen, causing death. Also, because so much fluid has leaked out of the circulatory system and into the lungs, blood volume drops drastically. The heart can no longer pump effectively, leading to a catastrophic drop in blood pressure and organ failure. But if the body survives past this stage, though, at the 11th day, then the body is able to clear the viral particles and repair the damage done. The immune system will be able to fight back with antibodies, slowly turning the tide of the war. The fluid in the lungs begin to be reabsorbed back into the bloodstream. By week 2, the virus will have been completely removed from the body, although the body still needs a lot of time to fix the damage, so full recovery won't be achieved until months later, as survivors often experience severe fatigue, muscle weakness, and occasional shortness of breath for weeks to several months as their tissues slowly rebuild. So the disease, while survivable with treatment, has a very long and unpleasant recovery process. So then with that in mind, what can be done to prevent the spread of hantavirus? First is preventing mice and rats from entering your house, cabin, garage, or shed in the first place. You can get through seemingly unassuming holes, as small as a quarter of an inch or 6 millimeters. Close and seal them if there are any. That way, rats and mice carrying the virus can't get in. And so your house won't be in contact with the virus in the first place. Secondly, rodents come inside looking for an easy meal. If you cut off the supply, they will look for somewhere else instead of your home. Wipe down counters and vacuum floors regularly to remove crumbs. If you discover a mouse infestation, a nest, or droppings in an old shed, cabin, or garage, you might be tempted to use a broom or a vacuum cleaner to clean it. However, you shouldn't do this, as sweeping or vacuuming sweeps the dry infected droppings up into the air, creating a fine mist of viral particles that you can easily breathe into your lungs. So it's important to clean it without spreading dust everywhere. That's why this doesn't work. To do this, spray the droppings, urine, or nest thoroughly with household disinfectant. Let it sit wet for 5 minutes to completely deactivate the virus. Now, use a paper towel or disposable rag to scoop up the soaked droppings and debris. Throw the used paper towels directly into a plastic garbage bag, and then wash your hands thoroughly with soap and water.